My name is Ashley Costa. I'm the Executive Director for the Lompoc Valley Community Healthcare Organization. Our mission is to ensure an equal access to a coordinated system of health promotion, disease prevention, and high-quality treatment service. LVCHO was established by a group of concerned citizens. It was created to address the high needs related to uninsured residents, and there was at the time a critical lack of health services in the community. So in the early day, it was really about healthcare access. You know, Lompoc was a rural healthcare setting, and we needed to establish more access to care. So what that looked like, for example, was partnership in the creation of a full-service outpatient substance abuse clinic. It was partnership to create the SART house, the Sexual Assault Response Team house, which is still located next to the old hospital location. It was the creation of our own pharmacy program for folks in Lompoc who were uninsured or underinsured. So in the mid-2000s, we shifted. We shifted to a more systems level approach. So we looked at how do policies, how does the environment, how do systems impact the culture of health in a community? And since then, we've really focused on 5 key areas that we believe impact health: healthy eating, active living, healthcare access, mental wellness, and whole person health. So what does that look like? Well, that looks like the Healthy Lompoc Coalition, a group of stakeholders and partners that we've convened since 2006 to partner and collaborate on projects that make Lompoc healthier. That also looks like supporting partners like Savvy Health Free Health Clinic or the Route 1 Farmers Market. It looks like projects led by the LVCHO, such as Creative Crosswalks, where we tried to figure out how can the art, economy, and health come together to promote active transportation in downtown Lompoc. Programs like Safe Routes to School, where we tried to incentivize and educate students in getting them walking safely and biking safely to and from school every day. It was like the Heal City resolution. So in 2012, Lompoc became the first Heal City in the county. For example, the Track and Field Project, the idea that the community needed a safe, free, and well-lit location to exercise and recreate. More recently, it's our WELL program, or what we call Wellness Empowerment for Lompoc leaders, where we get leaders together once a quarter and discuss important mental health topics so these leaders can then go and support their clients even better. Or perhaps our Healthy Happenings newsletter, a monthly newsletter, which is a repository of health information, health access, health resources, all put together in a beautiful newsletter sent out to over 1,000 people every month to try to increase awareness and education of how to be healthy. Having joined the organization over 11 years ago, I can say that I'm most proud of the organization being a community champion, being a true and tireless advocate for Lompoc, both in the community and outside the community as well. And we couldn't have done this work over the last 25 years without our amazing partners, without my wonderful board of directors, and most importantly, without my amazing staff. So thank you everybody for your support over these last 25 years as we've worked together to make Lompoc a healthier place to be.
My name's Brianne White. I'm the BOP Healthcare Account Manager at the LVCHO. I've been here for 13 years. The BOP is the Bureau of Prisons. The BOP healthcare contract we've held for 20 plus years. It's important for our local organization to hold this contract because it brings revenue to our community. It brings providers to our community. We have a huge success with bringing local providers in, and that serves both our inmate population, which helps the LVCHO, but also brings providers to our community in Lompoc. We have grown to love the providers in town, and the community that we have built is amazing. So I look forward to many more years supporting our providers and having a great relationship with our providers in Lompoc.
My name's Schlosser. I'm a family physician. I've been in Lompoc for 36 years. Currently practicing with Lompoc Valley Medical Center Clinic in North H Street, but I've been also in private practice for 32 years before that. Well, I feel that physicians, we spend most of our time dealing with disease, dealing with individual patients, individual problems, but I've always felt that physicians should have a role in the greater health of the community, being leaders in promoting health in the community at large rather than just one person at a time, and having a leadership role in the bigger picture of healthcare. And I think this organization has had a key role really in the overall health of Lompoc, in that we've been instrumental in multiple programs that have, I think, contributed to the health of the community, with various community projects, including going into the schools, looking at ways to prevent childhood obesity, which is an epidemic, promoting healthcare, promoting healthy lifestyles, basically promoting exercise, things like being involved in the renovation of the stadium, which has been a great community benefit, and that people can take advantage, and walking the track and being more healthy. I think promoting exercise is hugely important in the health of the community. In the early days of the organization, we were able to provide funds to help the emergency department increase access to care. In the initial early days, we were able to generate revenue from our management of the Bureau of Prisons contract, so that we could actually give financial support to the hospital to help with access to care, mainly through emergency rooms. So that's another thing that I think has been important, although that's less of a role now. I think we're more focused now on community projects. I look forward to the future of our organization. I think we've got a great future. I think there's just so many things in Lompoc that we can do. There's so much need. We've been involved with caregivers. That's a huge need. We've been involved with helping uninsured patients. It's a huge need. There's mental health. There's a huge need there that I think we can be more involved with. There's just, the list is endless, really, of the things we could potentially do.